Welcome to CE Institute. My name is Selena Belisle. I am the founder and one of the approved CE providers here that teaches medical errors prevention. Now, we mostly teach CE credit for licensed healthcare practitioners to fulfill their requirements to relicense. And usually medical errors prevention is required of most licensed healthcare practitioners every 2 years when they do relicense for their practice. Now, in this section, we're only going to give you a blurb of what we have recorded for our medical errors prevention course that includes this information, but this should be a good starting point if you're interested in this topic. There is a medical journal called the U.S. Pharmacist, and they published an article back in 2009 titled Massage Therapy, Implications for Pharmaceutical Care. And they stated, and while the article is a little bit dated and older, it's very rare that we have published information about the impacts of prescription on massage. So I'm going to cite from this article. They said in 2004, the U.S. Department of Health and Human Service reported that 1/2 of people in the U.S. take at least one prescription medication. That means probably about half the people getting on your table are on some type of prescription drug. And 1 in 6 people take 3 or more medications. There is a medical journal called the U.S. Pharmacist, and they published an article back in 2009 titled Massage Therapy, Implications for Pharmaceutical Care. And they stated, and while the article is a little bit dated and older, it's very rare that we have published information about the impacts of prescription on massage. So I'm going to cite from this article. They said in 2004, the U.S. Department of Health and Human Service reported that 1/2 of people in the U.S. take at least one prescription medication. That means probably about half the people getting on your table are on some type of prescription drug. And 1 in 6 people take 3 or more medications. We also know that some individuals misuse their medications. Sometimes it's done purposely, sometimes not. Sometimes we have older folks at home that forget to take their medication. And if they forget to take their medication to control their blood pressure or other issues, that could also impact the effects of your massage. Now, today we're only going to focus on what we can control and what we know. And it will not be an exhaustive list either. But you do need to keep that in mind, especially when working with elderly folks who are on a lot of medication. As we get to 65 years old and older, about 50% of our drug use in the U.S. is said to be amongst geriatrics, in that smaller bracket of people. So even though geriatrics do not make up the majority of our population, they do make up the majority of our prescription drug use. And when somebody's on prescription medication, we only hope that they are taking it properly and not misusing it. The Mayo Clinic reports that an individual might purposely abuse their prescription drugs for some of these reasons, such as to feel good or get high, to relax or relieve tension, to ease pain, to reduce or curb their appetite, to increase their alertness, to experiment the mental effects of the substance, to maintain an addiction and prevent withdrawal, or they're taking it because peers have pressured them to do so. Regardless of why your client has taken a medication, it's important to learn the side effects of some medications to know when it might be contraindicated or you have precautions that you might use with your massage therapy treatment. If your client is ever exhibiting serious illness, such as vomiting, fever, loss of consciousness, dizziness, extreme fatigue beyond their normal, you should refer that client back to their doctor for reevaluation. I would not massage someone who has any of this presentation at my treatment room, because these signs could be something that's showing a more serious illness that can only be diagnosed by a doctor. This is particularly important when a client has been prescribed a new medication. They might need a prescription modification. The dosing might be too much or too little, or they might be allergic to the medication. A good example of this is somebody who has a sulfa allergy. Many times people do not know they have this allergy until they're taking an antibiotic that has sulfa. And this will produce swelling, anaphylaxis, sweating, fever, vomiting, and a client might not feel well. They've been to the doctor, they've been treated for whatever their medical issue is, they've got their medication, and now they're booking a massage because they don't feel well, and they think everything's fine because they went to the doctor. They just, they think a massage is going to help them feel better, and it might, but what's really happening is they're delaying that doctor's evaluation of their new illness, whatever's presenting, vomiting, fever, sweating, swelling of the tongue, and so forth. That could be a medical crisis, okay? And when you have these types of new medical conditions, even if they're taking prescription medication for their illness, we really need to get them back to their doctor to make sure there isn't something more serious or life-threatening going on. In this case, with the sulfa antibiotic, that could be a life-threatening condition if the client continues to take the medication and is not properly evaluated. I've been taking and teaching medical error prevention training for decades. And it's interesting, on one of the surveys, and I always, in my CE classes, I ask for surveys and feedback from the students for board requirements, and also to learn what our clients, our customers are thinking about our training. And it was interesting feedback from one of my students who said, if my client isn't feeling well, I'm just going to give them a massage and make them feel better. I don't need to refer them to a doctor. That's really making a decision that is not ours to make. We do not diagnose illness, any type of illness, and it's not for us to determine whether or not the client needs greater medical intervention. That's something that a doctor must decide. So I really think massage therapists are taking a chance when they have someone who's really not feeling well and massaging them. When a client is really not feeling well, again, that could be a sign of underlying disease. Maybe the medication dosing was wrong. Medical errors are a top 10 leading cause of death in the United States. Doctors make errors too. They could have prescribed the wrong dosage to a client, especially if they come in and, oh, I just took my medication and now I feel 10 times worse. We really need to get those clients back to the doctor to make sure that when you do provide your massage therapy session, it's safe and therapeutic. Now, there are some medications that will make a client feel worse than if they hadn't taken it at all. And in some cases, that's acceptable. And I'll give you an example of that. Many oncology clients who are taking chemotherapy will feel quite ill the day after their prescription administration. So, in those types of cases, you would want to make sure that you have proper specialty oncology training when working with oncology clients to know chemotherapy side effects and when it might be appropriate to refer that client back for medical evaluation and when it might be safe to provide massage on a client taking chemotherapy. It really takes time, education, experience, and practice to learn all the different potential safety hazards with massage and medications. And we still don't know them all. There's new medications coming out and being authorized every day for use. And we won't know how the client responds or an individual responds to massage when they're on that medication until they've actually experienced it. So this is like a non-stop clinical trial that's going on in the world today as more and more medication comes to the market. We do hope that reviewing some of the following classes of medications, in particular drugs themselves, will be helpful in enlightening to know what would be appropriate modifications and so forth in your massage therapy sessions. Now, keep in mind, despite the amount of prevalence of prescription drug use and illegal drug use here in the United States, we have very little research studies about massage and medication and drug use, okay? So I'm going to give you what we have published thus far and some additional resources. And remember that every individual responds differently to medication. We are unique. Not everybody's going to respond the same. So some people might have different effects than others. So to sum this up, the U.S. Pharmacist Journal article stated medications may affect several aspects of treatment planning, including the scheduling of your treatment, the treatment focus, and the duration of your massage. Also the techniques that you might use during your bodywork treatment, and the client's cooperativeness might be affected as well, depending on the prescription drug that they are using. The article states patients receiving drug therapy for chronic disease, such as diabetes or high blood pressure, are less likely to require a massage treatment modification because their medical condition is usually stable. And they have achieved stable levels of medication too. This is tried, true, and tested. We know that the client is doing well. Those are the clients that will probably require less modification for your massage session. The U.S. Pharmacist article continues that patients who are receiving new drug therapy for an acute condition, such as opioids for pain, may require more extensive treatment planning for your massage in order for it to be effective and safe. The article further states that medications have a wide variety of effects and may alter blood clotting mechanisms, neurosensory feedback, tissue integrity, and pain perception. So the effects of those medications should be taken into account when the massage therapist, when the practitioner, you are selecting the manual technique that you're going to use and how you're going to apply it. This article detailed that the following classes of medications could influence the type, style, pressure, and duration of your massage. And this includes analgesics, cardiovascular medications, anti-diabetic agents, anti-neoplasmic agents, antiretroviral agents, and antipsychotic agents. When you're independently evaluating your client for treatment with each appointment, okay, just because a client was feeling a certain way after their last appointment doesn't mean that today's going to be the same. And that's particularly in reference to oncology clients. Okay, sometimes they're fine after their chemotherapy, sometimes they're violently ill, sometimes they're somewhere in between. Okay, so just make sure that when you're practicing, remember we're all individuals, we respond differently, even if it's the same massage and the same medication at the same time of day with the same appointment duration and so forth. The results could be different every time. If there is an adverse event where the client does not feel well after the treatment or something like that, it's important to document it, try and determine why that event occurred and learn from it, and even share that information with others so that if something did go wrong, we can help correct that and prevent that from happening again. I hope you were able to enjoy that little bit of information on how medications could adversely affect a massage therapy appointment. If you want to learn more, you can either actually purchase our training, the Medical Errors Prevention Training that includes this here at the school at ceinstitute.com. You can also look up the article yourself on uspharmacist.com. We've put the link here on this PowerPoint slide so you can see where we got the information. We actually teach a lot more information from that article, which you can look up right there, or I can narrate it for you if you do purchase the medical errors training that includes this subject. So we hope you enjoyed, and until we see you in a training, be safe.